Well, we're here with Dr. Zaibak, a dentist in Chicago, actually in Tinley, which I think is a suburb of Chicago. Is that correct, Dr. Zaibak?
Yes, that's correct.
Well, Dr. Zaibak, tell me, you have a practice in the Chicago area, and many patients, they're not quite sure, is a dentist a dentist? Basically, are all dentists the same? On one hand, we feel they are. On the other hand, we kind of have a feeling that they're not. Why don't you kind of shade a little bit of light on your practice, your style of practicing? What can your patients expect? In fact, maybe tell us why you became a dentist in the first place, if you don't mind.
Sure. Well, I became a dentist because, one, I like to help people. I'd like to get people out of pain. I'd like to make pretty smiles, and I like to work with my hands. And my father and my parents geared me towards it, as they've always given me things so I can, work with my hands, and they've always promoted me and, in school and said, you need to be in the medical profession, whether it be a plastic surgeon or dentist. And I was always geared to kind of making, beauty, kind of making things much more enhance the smile or whatever it be to make the person overall. It's more of a gratification, seeing someone, instant gratification when you basically do veneers and things like that. And that is where really I became a dentist.
All right. Well, you mentioned veneers and you mentioned beauty. Obviously, with no doubt, dentistry, like many professions, but I think it shows in dentistry very heavy, is on one hand it's super clinical, technical, scientific if you want to, and on the other hand it's extremely aesthetic. A crown or a veneer can be perfectly all right clinically, and yet still don't get that, just like a gorgeous feeling. Some girls maybe are very pretty, but another girl next to it is just same pretty, but for some reason is radiates more. And I'm sure this has to do with crowns and bridge as well. Is that true?
It's absolutely true. It all depends on a number of factors. One being the type of crowns or ceramics that the dentist is using, the type of laboratory that the doctor is sending his crowns and veneers and so on to. So it's all depends on a number of factors. One, the dentist knowing which crowns and which veneer, which types of crowns, which type of ceramics to use in each particular case, and where to send and what's available out there. Obviously, the more knowledgeable dentist is about the material that exists out there, and there's new material happening and being introduced daily in the dental industry. And if you're aware of all these things, then you're able to basically use each ceramic material, crowns and so on, to a specific case which will give you the aesthetic results the beautiful results that you were looking for.
Sure, but isn't it even a little bit more, for instance, a little bit like a fashion designer? Some people do better in blue, some do better in red, some do better with stripes up or down, sidewards, whichever way. Some people, look better with a dye, without a dye, whatever it may be. In the case of dentistry, long teeth, bright teeth, white teeth, a little bit more forward, a little bit more back. It does not all have to do with it, and is that the dentist's decision basically to say, I think if we make your teeth just a little smaller or a little brighter, it would be like just wow. Is that all something which falls under the aesthetic part of a dentist like you?
That is definitely, it's all in the hands of the dentist. I've taken many cosmetic dental courses, you become more knowledgeable of, what shape and size and color that would best fit that person. I mean, you're not going to just make one set of shape crowns and just put them on everybody. Each person, some people have rounded faces, others have elongated faces, and you have to complement the teeth with the shape of their teeth and their face, and with also the shade of their skin. That all comes into with experience with a cosmetic dentist per se.
Good. Now, we talked a lot about cosmetic dentistry. Obviously, that's a big part of your practice. Now, what about a guy who, comes in and wants what I think is called functional dentistry? He has maybe a tooth or two missing, maybe has a little bit of periodontal disease, but he doesn't want the Brad Pitt, Julia Roberts, Tom Cruise smile. Whatever his smile is, he's totally fine with it. Would that person be out of place in your practice, or will you be able to help him too?
Absolutely, we would be able to help him. I mean, cosmetic dentistry is not just cosmetic; it has to be also functional. You can't put beautiful teeth on somebody who has periodontal disease or somebody who has missing teeth in the back. You have to correct the occlusion, the back teeth first, take care of the gum diseases before you even try to make it, step into the cosmetic.
And I understand that, and very obviously that's very clear. But let's just say a person who, is a patient out there, who doesn't aspire this type of makeover, but he wants his teeth to be functional. He doesn't want to have his bite or his teeth grinding and out of alignment and things like that. And that's all he wants. Should he still come to you? Or are you only doing work if there is cosmetic work behind it?
No, we're a completely general practice. We do a full service dentistry. We do anything from fillings to root canals to cosmetic dentistry. But we're renowned for cosmetic dentistry.
I got it.
We have any type of patients. Yes.
What about are you working with children at all? Like say a family dentist, parents bringing their children.
Yes, absolutely.
Okay.
Absolutely, we take care of.
What about orthodontic work? Are you doing some of that, Invisalign or something like that?
Yes, our practice does mainly we basically, our philosophy is no metal, and that basically means Invisalign, veneers, crowns, anything that doesn't have any metal. That's what our practice is.
All right, good. All right, so basically you do really the whole spectrum and make a mouth functional. Well, thank you very much, Dr. Zaibak. In fact, didn't you just release a book?
Yes, I did this year. It's called The Hidden Truth Behind a Beautiful Smile.
The Hidden Truth Behind a Beautiful Smile. Wow. Okay, is the book available? Amazon, Barnes & Noble type of stuff, bookstores?
Absolutely. It's available on Amazon, and it's also available on Barnes & Noble as well.
Good. Well, thank you very much. Okay, I'll talk to you more about it.